Hello students, good morning. Hope you are doing well. Hope you have done your exams well. So the paper was comparatively easy for PSM sessions. So you all would have done well. So don't worry, everything will happen for the good. Now we will have a recall of the model questions which are asked in your exams. We will have a recall of all the questions that are asked. They're similar model questions. So we'll start. So we had a logo. They asked, what is that logo? What is the logo of National Leprosy Eradication Program? So National Leprosy Eradication Program. So this is the logo. So the logo of what? This is the logo of National Leprosy Eradication Program. We studied in our workbook. We studied clearly about the purity of the lotus. What is the meaning of the purity? We should not discriminate. We should not discriminate people with leprosy. That is the main thing about this logo. They are also pure people. We should not discriminate them. So they have given other logos. This is the logo of National Tuberculosis Elimination Program with the heart, with the lungs. We have the lungs here. Lungs NTEP. This is NTCP. National Tobacco Control Program. Choose life, not tobacco. Then some of the students, they told, we saw a school going child. There are two types of school going child. One, this child. So you can see here this child. Okay, you can see here this child. So this child is Sapna, SAPNA, Sapna. This is the campaign mascot for our National Leprosy Eradication Program. Campaign mascot for National Leprosy Eradication Program, Sapna. School going child, she is cured, she once had leprosy, now she goes around and she creates awareness about leprosy. Then similar to Sapna, we also have something called Meena. So Meena, this child is also for leprosy. It is mainly used by UNICEF. So if you see UNICEF, they have created many video series. In many countries, they are creating the video series like the Meena. She is creating health awareness and awareness about many issues through a video series. That is Meena. So you can also have this type of picture. Next question. A 35-year-old male is coming. He has a disease condition. They are measuring a coproporphyrin levels. So for what disease coproporphyrin levels are measured? So porphyria, now based on the options given, it is lead poisoning. It is lead poisoning. Lead poisoning, we can measure aminolevulinic acid. Then we can look for coproporphyrin in urine. Or we can also look for the lead levels in the blood, serum levels. So lead poisoning, how does it be inhaled? Mainly, we inhale the lead. We inhale the lead. Before and all, it was seen in petrol. Now the seen in paints. So it is also called painter's colic, plumpism. It can lead to two types of effects, organic and inorganic. So organic, when it crosses the blood-brain barrier, it causes insomnia, headache, confusion. Without crossing blood-brain barrier, anemia, pallor, abdominal pain. Then it can also cause blue line on the gums. So gums, we have the gums here, blue line on the gums due to anemia. So silicosis, silicon. Anthracosis, coal dust. Asbestosis, asbestos fibers we are using now in our houses. Next, a disease X has an incubation period. So what is the incubation period? It is around 5 to 10 days. What should be the quarantine period? It is simple. We are studying now what is quarantine. So quarantine means I am healthy now. I am a healthy person. I am going to China. In China, there is COVID-19. I am coming back to India. While coming back to India, also I am looking healthy apparently, but I could have been exposed. So I should be observed. For how much time I should be observed? I should be observed for maximum incubation period. I should be observed for how much time? I should be observed for the maximum incubation period of the disease. I should be observed for the maximum incubation period of the disease. That is, for this much time, quarantine has to be done. So quarantine has to be done for the maximum incubation period of the disease. It is done for those people who are healthy, but they may be in the incubation because they have been exposed. So for how much time we will do isolation? Isolation is done for period of communicability. We have discussed so many times this. So next question. Calculate NMR. So what is NMR? Neonatal mortality rate. So what is neonatal mortality rate? See here, you can see here what is infant. From birth to 1 year, it is infant. From birth to the first 28 days of life is neonate. From birth to first 7 days of life is early neonatal period. So what is the formula for neonatal mortality rate? We saw in the page number 200 in our book, Preventive Obstetrics and Pediatrics lesson. So numerator, what is the numerator for neonatal mortality rate? Numerator is number of neonatal deaths. So next, what is the denominator? So numerator is number of neonatal deaths of the denominator. Denominator is the number of live births. So what is the neonatal deaths here? 10. Live births is 1000. So 10 per 1000. So this is usually a rate. So we multiply by 1000. So we express it as 10 per 1000 live births. So neonatal mortality rate. In case if they have asked about yearly neonatal mortality rate, it is simple. Yearly neonatal mortality rate means death of the neonate within the first 7 days of life. It is 7 per 1000 live births. See here, if you see here. So the majority of the deaths they occur within the first 7 days. In the first 28 days, 70 to 80% they occur within the first 7 days. See here, 75% of the neonatal deaths occur within the first week of life. 75% occur within the first week of life. Okay, guys. Next, JSSK stands for JSSK. We have told so many times in the class. JSSK, Janani Shisu Suraksha Karyakram. Janani means what? What we are told. Remember, Janani means Amma, mother. Shisu means what? Baby. This is, you can remember like Janani, baby is Shisu, Janani, Shisu Suraksha, wellness. Suraksha Karyakram is program. So Janani Shisu Suraksha Karyakram. Mostly Karyakram program Suraksha wellness. So JSSK Janani Shisu Suraksha Karyakram. The following falls under the recovery phase of disaster cycle. So what is the disaster cycle we saw? What are the phases? 3 phases. First, before the disaster strikes, risk reduction phase. What we do? We do mitigation, preparedness, capacity building. We keep us ready. Then the disaster strikes us. So first the disaster, we are having the risk reduction phase. Preparedness, capacity building, we are doing, and then we are having some mitigation. Then the disaster is striking us. After the disaster strikes us, we do the recovery phase. What we do recovery phase. So they are asking the following falls under the recovery phase. What are the things falling under the recovery phase? Response, recovery, rehabilitation, reconstruction. So in this recovery phase, what are the things we are following? We are having response, immediate response, that is like doing a triage. Then we have to do recovery, rehabilitation, reconstruction. Everything falls under the recovery phase. So the recovery phase, we have rehabilitation, response, and reconstruction. So mitigation, preparedness, capacity building, they come under the risk reduction phase of the disaster cycle. So risk reduction phase of the disaster cycle. So in order to prevent thiamine deficiency, which of the following should be taken in the meals? Thiamine, so you have a thali meals here, which will you prepare? What are you going to eat? So this is the rice. You can eat rice. See here. So rice, wheat, maize, they are important cereals. They are a good source of B group vitamins, especially thiamine. We saw in the class now. What is the rice? The rice has 3 parts. Germ or embryo, inner endosperm, outer pericarp layer. Thiamine is present in the outer layer. So when we do what? Polishing, all these things will be lost. So what we have to do? We have to do parboiling. So partial cooking in steam. It tells the minerals from the outside to go inside. So rice, out of this thali meals, rice is a good source of thiamine, B group vitamins. So the following is a set of data obtained by measuring the weights of children. Calculate the median. So median we saw measures of central tendency. So what are the measures of central tendency? The measures of central tendency, we have three things: mean, median, and mode. Arithmetic mean, mainly we are following median and mode. So what is median? Median means center value, middle value. We have to first arrange in ascending order. So first we have to arrange in ascending order. So we have arranged in ascending order 3, 3.5, 4, 5, 5, 6. So how many values are there? 1, 2, 3, 4, 5, 6. So if there are only 5 values, we can take the center. But here there are 6 values. So there are 2 values in the center. So how many values are there in the center? There are 2 values in the center. If there is only 1 value, we can take that as the answer. But here there are 2 values. So it is not 4, not 5. We have to take the average of these two, that is 4.5. This is a simple sum. So there are even number of observations, take the center 2, take the average. Odd number of observations, you can take the middle value. Next, which is the earliest appropriate time to insert IUCD in a female with G2P1L1 on postnatal day 1? Okay, so this G2 will not come because he has delivered. When she delivers, it may become like P1L1 or P2L2. Okay, so this G2P1L1 on delivery, it may become P2L2. On postnatal day 1, which is the earliest appropriate time is, so the best time is within the first week. Here, the best option is within the first 48 hours. Within the first 48 hours, we can insert the IUCD. The best time you have seen means it is within the first week of beginning of the menstrual period, or within the first week after the delivery, during the first week after delivery, or 6 weeks after delivery. So first best is first week after delivery or after 6 weeks after delivery. Then what they are asking, earliest appropriate time. So this is the best. So this will not come. This is a suitable option. But among these two options, which is the best cannot best is the same. The earliest appropriate time to insert IUCD. Next, in a gynecology OPD, a 30-year-old female, she is coming with 22 weeks of pregnancy. She wants to do MTP because the pregnancy is due to a sexual assault. One of the following statement is correct. See, 22 weeks. So now the MTP Act, it has been amendment in 2021. We can see in our books in page 218, in our workbook. So in our workbook, we are told clearly up to 20 weeks. So till 20 weeks, opinion of one doctor, we can do MTP. So till 24 weeks. This is in normal cases. So 24 weeks is in case of special. This is for special cases like rape survivors, victims of incest, vulnerable women, differently abled women. So in these cases, we can do till 24 weeks. But what? We need the opinion of how many doctors? We need the opinion of 2 doctors. So we need the opinion of 2 doctors. Only after that, only we need medical board. Medical board approval is only beyond 24 weeks. Beyond 24 weeks due to some fetal anomaly. So MTP can be done after 20 weeks also, after 24 weeks also. After 24 weeks, we need the opinion of the medical board. Between 20 to 24 weeks, we can do it with the opinion of 2 physicians. In a medicine OPD, the patient is not able to understand the words of the doctor. So he is not able to understand this, maybe due to the language barrier or maybe illiteracy. They may be illiterate. He is not able to understand, or there may be differences in their social customs, beliefs, or religion, some things. So the barriers of communication, we have told in page number 240. I am so happy we have given these barriers of communication: physiological, psychological, environmental, and cultural. Here there is no mention of any emotions. So psychological will not come. So there is no any mention of like impairment or handicap. So physical will not come. And physiological also, there is no mention of any difficulty in hearing or anything. So the easiest is cultural. Arrange the various stages of demographic cycle. So we have the various stages. What is the first stage? High stationary will be the first. High stationary will be followed by yearly expanding It will be followed by late expanding. India is in which stage? Late expanding stage of the demographic cycle. Then this will be followed by low stationary. Then last is the declining phase. Then last is the declining phase. So high stationary, first year, 1920s and all, lot of births, lot of deaths. So 500 births, 500 deaths, so the population was constant. Then slowly there was improvement. The medicine improved, so the number of deaths reduced. But still there were a lot of deaths. There were a lot of births. But since the science improved, the number of births were removed, that's clearly expanding. Now, late expanding stage, we have a lot of awareness about the births. We have to reduce our birth rate. But although we are having awareness, the number of births is so much. Like the number of births is more than the number of deaths. Although we have reduced our fertility rates, but till now, the births is so much. If you see in India, the crude birth rate is ranging around maybe 19 to 20. But death, if you see, only around 6 to 7. For every 1,000 people, you see, for every 1,000 people in India, every year, 19 to 20 children are born, but only 6 to 7 deaths are happening. So this is called as the demographic gap. So our population is increasing by 13 for every 1,000 people. This is called the demographic gap. So India is in late expanding stage, followed by low stationary stage. Maybe countries like Australia and all have very low birth rate, very low death rate. So stationary. In some countries, maybe like Switzerland and all, if you see declining. So they are married, but they don't have any children. They die. So the population is decreasing, declining stage. The vaccine kept at the bottom of the ILR. So you can see the ILR. What is the arrangement? First OPV, measles, then we have BCG, then we have JE here. So if it is a reconstructed BCG, you can keep it here, reconstructed BCG. Then above will come everything like rotavirus vaccine, TT, then rotavirus, TT, DPT, then Penta, hepatitis B. So the vaccine which is kept at the bottom, which can be kept even in contact with that of the bottom of the ILR, so that the freezing temperatures will not affect this OPV. This OPV can OPV. Then there was a question about this cholera vaccine, Shankol oral vaccine. It's usually out of the box. This can be because it's not used very commonly. It's not in our national immunization schedule. So 2 doses. So how many doses? 2 doses. It is a 2-dose Shankol vaccine. It is a bivalent vaccine. 2 doses and it is a bivalent vaccine. O1 and O139. You can see it is a bivalent vaccine. Next, the following is the special use of kata thermometer. See, so what is this? Is the kata thermometer here. So what is the kata thermometer? Thermometer means the means temperature. Thermometer means temperature. Whatever may be a thermometer, globe thermometer, maximum minimum thermometer, dry wet bulb thermometer, any thermometer may be temperature. But the special use for kata thermometer is it can measure the air velocity at the lower speeds, measures the slightest of air movements. But its main thing is cooling power of the air. This the main thing is cooling power of the air with the help of temperature. But special thing is measurement of air velocity at lower speeds. So next is sampling. So there's a nice question. So sampling, now I want to check what is the height of the children in 3 batches of students in my school. In a school, first year students, second standard, third standard. So I have to check that. So how I'm going to select? I'm selecting the 3 batches. Out of the 12th, from first standard to 12th standard, I'm selecting only the 3 batches. So 3 batches I'm selecting. In these 3 batches, I am only taking how many students? Only 5 students. So there are only 3 batches. They are telling the question, although there are 12 batches in the question, they have given only 3 batches. They are dividing it into 3 batches. When they divide into 3 batches, it is called stratified. What is this called? Stratification into groups. Stratification means what? Groups. So already groups are there. Already males and females are there. It is a group. Stratification. From this group, we can take randomly like a lottery method. We are taking someone randomly. Then it becomes stratified, random sampling. Stratified, random sampling. These are all what methods? Probability sampling methods. simple random, systematic random, stratified random, cluster random. These are all probability sampling methods. Snowball, convenient, quota, non-probability sampling method. In probability sampling method, everyone has an equal chance of being chosen. So when there is there is a division of the groups, and from each group we are selecting the people randomly. Then it becomes what type? Then it becomes a stratified random sampling. The following formula denotes. So the numerator, denominator. So see the numerator. So the numerator is maternal death. If the numerator is maternal death and denominator is live birth, then it is maternal mortality ratio, because numerator and denominator are different quantities. Maternal death, mother's life, denominator, child life, live birth. If they are different, it is maternal mortality ratio. But see here, numerator is maternal death, mother. Denominator also belongs to the mother or the woman of the reproductive age group. So both of them are similar. So every woman, she becomes a mother. So both are of similar quantity. So when the numerator and denominator are of similar quantities, then we call it as a rate, maternal mortality rate. But actually what we are studying, MMR generally denotes maternal mortality ratio. What we are studying in MMR means, it generally means maternal mortality ratio. MMR generally means maternal mortality ratio. What we are studying, it should be less than 97, or it is 97 per 1 lakh live births. What we are studying now, that is maternal mortality ratio. Because the numerator is maternal death, denominator is live birth. But here in the question it is different. Numerator is maternal death. Denominator is not live birth. Instead, the denominator is women of reproductive age. So next question, the geometric mean of. So we have three things: life expectancy at birth, schooling index, per capita income index. So geometric mean. So when you have three things: life expectancy at birth, it is the index of longevity, the index of knowledge as expected years of schooling and mean years of schooling, then income, real gross national income per capita. So whenever we have this income, it will definitely be STI, it will not be PQL. So PQLI will not have income. So PQLI will not have income. It has only three things. PQLI, it has education, that is the knowledge. And then the second one is life expectancy at age 1. Third one is IMR, infant mortality rate. So only these three things, they make up the PQL. And if you see here, STI, it only has a special thing called as the per capita income, real gross national income per capita. Next, accurate test for differentiating azumon oil with mustard oil. So what is this disease? So maybe they would have given like some clinical scenario. A patient, he developed epidemic dropsy. So epidemic dropsy means what? Azumon oil with mustard oil. With this, you should also use your clues from the biochemistry or from the medicine. Also, you should use the most sensitive test is paper chromatography test. If this option is not there, if the option is like nitric acid, we can use that option also. So for epidemic dropsy, for differentiating azumon oil with mustard oil. So mustard oil is a good food product. With this, they are mixing an adulterant. That adulterant is azumon oil. So in order to differentiate it, in order to see whether it is adulterated or not, we have to use paper chromatography test. So the following are the steps of case control study. So case control study, first step, selection of cases and controls. Then next, we have to do matching. Third, measurement of the exposure, and then analysis. These are the steps: selection of case and controls, matching, then we measure the exposure, it comes as a part of analysis, and then we do the interpretation. So the correct choice is 2, 1, 3, 4. So selection of cases and controls. So let's go ahead. So first step is selection of cases and controls. It is the first. Then next one is matching. Then we have the measurement of the exposure. And so 2, 1, 3, and 4. Next, time between onset of symptoms in primary case to onset of symptoms in secondary case. So this is the exposure. Following this, we are developing a group of primary cases. Then from them a group of secondary cases develop. So what is the time interval between the opening scene of the first serial and the opening scene of the other serial? Serial interval. Time interval between the opening of the primary cases and the opening of the secondary cases. It is called serial interval. What is this generation time? Generation time is the time between the receipt of the infection by the host to the maximal infectivity of the host, or time between the receipt of the infection by one host and the receipt of the infection by another host. That is called as the generation time. And incubation period is the time between invasion of the infectious agent with the appearance of the first symptom, like my first cough. After the time between the invasion by the agent and my first cough. Quarantine should be done for maximum incubation period of the disease. So next, an interesting question, a farmer harvesting fruits. We can remember like Kerala, it was more common before a few years. Harvesting fruits like they work in the rubber tree plants or mainly bananas. He develops high fever, respiratory depression, dyspnea, slowly is going into coma, neurological complications. It is typical of Nipah virus disease. So Nipah virus disease. So recent outbreak you can also remember in 2018 in Kerala, Nipah virus disease, encephalitis, mainly encephalitis. Investigation of choice, RT-PCR, no specific treatment. They mainly die of respiratory failure, mainly from the fruit bats. Transmission, human to human transmission occurs mainly through respiratory route or physical contact. Nipah virus disease. Even in there's a movie in Amazon Prime, you can watch the movie name is Virus. There is a Malayalam movie nicely depicts about this Nipah virus. Next, last about the statistical tests. Very, very good questions. Easy and clear-cut questions there. What is the statistical test to be applied to study the effect of modification of diet on blood sugar levels by measuring the value of blood sugar levels in 100 days before and after the intervention? So before and after. So what they are telling, two groups. So that is only one. What they are measuring, blood sugar. So these are the clues from the question. Blood sugar, two groups. Blood sugar is quantitative or qualitative? Quantitative or qualitative? Blood sugar is a number. So it is a quantitative. So quantitative, how many groups? Two groups. So we have two groups. How are the two groups? They are similar or different? They are similar groups or different groups. Now see, for the same 100 males before the intervention, after the intervention, so they are similar groups. So similar groups means it is parity test. If they are two different groups, males and females. Males, one intervention, females, one intervention. Then it becomes an unparity test. If there are more than two groups, like males, females, children, very old male, very old female, like this, there are many type of groups. More than two groups means ANOVA, analysis of variance. So these are all for what data? Quantitative data. These are all for what data? Quantitative data. So next, which is the statistical test to be applied to study the association of type of diet with development of diabetes mellitus? Type of diet, veg or non-veg, then with development of diabetes mellitus. So if you see here, it is a qualitative data, yes or no type. Diabetes mellitus, yes or no. Veg, non-veg. So the blood sugar, there it was what? Blood sugar was the outcome. Blood sugar was what? It was a quantitative, but here it is qualitative, diabetes mellitus. So qualitative, without anything you can tell chi-square test. So qualitative, mainly chi-square test. So there are some modifications of chi-square test. If in any of the cells, the value is less than 5 in any of the cells, at that time we can use Fisher exact test. In any of the cell, if the value is less than 5, then we can use Fisher exact test. The same qualitative data for two paired groups, we use something called McNemus test. We use McNemus test. So, but for this UG level, you can only remember for qualitative data, mainly chi-square, if the number of the value in any of the cells less than 5, it will be Fisher exact test. Thank you, students. Thank you. So hope you are doing well. they see the results. So let's hope that next phase of your life will be more and more happy. All the best. Thank you.